Okay. Good afternoon, everyone, or good morning, depending on where you are, and welcome to today's webinar. My name is Casey Murphy, and I'm ACT's Director of Programs and Events. I want to thank you for joining us today for ACT's first webinar this month entitled COVID's Lasting Impact on Public Transportation, Lessons Learned to Build a More Resilient Future, sponsored by our good friends today at TransLoc. Before we hear from our presenters this afternoon, I wanted to quickly take care of a few housekeeping items. First, all attendees are on mute during this webinar. If you have a question or have a problem hearing us, please type it in the chat box located in the toolbar at the bottom of your screen. We will do our best to answer your questions as the webinar gets going. Second, we'll be hosting a Q&A at the end of the webinar, but please feel free to type in your questions as we go in the Q&A box located on the toolbar at the bottom of your screen. Note, when asking a question today, please also identify who the question is for when typing it in. Finally, this session is being recorded and we'll have the recording up on the ACT website within 24 hours after the presentation ends. Usually this is the time I turn things over to David, but instead I will be giving the ACT update this afternoon. As the premier association for TDM professionals, ACT's goal is to build a strong community of individuals and organizations working to advance and implement TDM at their work sites and within their communities. ACT is your organization for the latest information and best practices in TDM. If you are not yet a member, I invite you to join our colleagues and become a part of our community. I guarantee you that ACT membership will be a valued investment in your professional growth and development. Before we get started, I want to take a moment to update everyone on some of the news from ACT. Registration is now open for our virtual TDM forum. The event will feature unique opportunities for attendees to network and discuss TDM issues in small groups while learning about broader TDM challenges and opportunities. Then this event will also feature the release of ACT's 40 Under 40 honorees. More details will be coming out next week, highlighting a few confirmed panel sessions at the event. In addition, registration is now open for the TDM CP exam. This is the only professional certification for TDM professionals in the nation. We encourage all eligible professionals to sign up, take the exam, and be recognized as a TDM CP. We have extended the exam period to December 18th to give candidates more flexibility and time to prepare. If you're ready to apply, visit the TDM CP exam overview page on the ACT website for additional information. Many of our members have set up study groups as well for the exam. So if you're interested, log into Connect, ACT's new online community, and join a member study group currently prepping for the exam. It is now my pleasure to introduce today's webinar sponsored by TransLoc, COVID's Lasting Impact on Public Transportation, Lessons Learned to Build a More Resilient Future. The majority of the country has been living unconventionally as stay-at-home and safer-at-home orders have been in effect for more than 6 months. TransLoc will be joined by some of their municipal customers to reflect on the lessons learned during this unparalleled time and how they predict these seismic shifts in the world of public transportation will impact their communities and the industry at large. Moving into 2021. Join BATA, Porterville, and GATRA for a panel discussion that will dissect the impact COVID-19 has had on transit and the trends that these mobility leaders are seeing for the future of public transit. It is now my pleasure to welcome Jermaine Grant, Director of Client Strategy at TransLoc, to introduce our webinar and welcome our speakers. Jermaine? Oh, Jermaine, you're on mute.
Yep. Thanks, Casey, and great intro there. Yes, have to hit the mute button for people to hear me. And so looking forward to this conversation with Richard, Eric, and Joanne. And we're very, very happy to host this forum. Really looking forward to having an interactive session and learn what our three esteemed panelists are doing at their locations. And as the label says, lessons learned to build a more resilient future. So how can we help each other during this difficult time with lessons learned, right? So we start getting to the slides here. Now, for those who don't know TransLoc, so TransLoc has been around since 2004, and there has been a recent merger last summer with Double Map and Ride Systems. So we're talking about three major players in the software space to support transit agencies and reselling of hardware. And so we're powering the most robust platform, intelligent transportation software solutions in the world. And so we're pretty proud of where we are and where we want to go and how we are supporting our customers through this time. So we have over 1,200 customers and 50 in 50 states and in also different countries outside of the United States. And this is a map of where we are. And you see our customers here represented in this map in California, Michigan, and Massachusetts, respectively. And this is our philosophy here: design, operate, and optimize. So again, this is all customer focused, customer centric, and this is even more needed today, where we can help our customers pivot and help meet their needs. Right, so just want to keep that very brief because I want to focus on the panelists. And but any questions at all about us, please feel free to reach out. Now, moving on to the important bit, the panelists, all right? So we have Joanne LaFerrara, sorry, of GATRA, director there, esteemed director of customer relations. We have Eric Lingaur, I'm hoping I'm not butchering these names, communications development at BATA, and Richard Tree, Field Services Manager, City of Porterville. And so again, these three lovely people decided to have a conversation with us. They're going to share their experiences with us and share what's happening in their neck of the woods. And I'm looking forward to the Q&As at the end as well. So we'll start first with Joanne, sorry, and she will go through guys.
Thank you, Jermaine. Good afternoon. I'm Joanne LaFerrara, the Director of Customer Relations for the Greater Attleboro-Taunton Regional Transit Authority located in Taunton, Massachusetts. Okay, so this is GATRA's service area. Currently, we're one of 15 regional transit authorities located in Massachusetts, and we are located in southeastern Mass. We service 28 communities, a mixture of urban and rural transportation. Although our services do not all connect, we do provide some service in each and every one of these towns, whether it be a fixed route, commuter transportation, intercity and intertown routes. We provide on-demand microtransit. We provide complimentary paratransit, local dial-a-ride, local and long-distance medical transportation. And in addition, we also broker all mass health transportation for our part of Massachusetts. So what we've done, how we've adjusted to COVID. I'm sure everyone realizes Massachusetts was hit extremely hard with COVID. By the end of March, the whole state was basically shut down. But we still had to provide essential services because Massachusetts has a lot of hospitals and and even retail areas, they needed to go get to work. So what we basically did is we reduced service hours, we suspended some routes, and in the routes that we totally suspended, we added a local dial-a-ride where people could call in when they needed to get out for essential services such as groceries, prescriptions, pharmacies, things like that. People could call in advance for a ride. We did extend the services on our microtransit because we found that people really responded to the same day type of service. And even though that is we only have a microtransit in one area of 4 towns actually of our service area, it proved to be extremely well used because we extended it to Saturdays. We waived all fares to eliminate the transfer of money and cash. And we basically, because buildings were shut down, people couldn't get in to buy passes. So we eliminated all fares probably from March until the end of August. I think we started them up at the beginning of September. We mandated masks. We equipped all buses with protective shields, gloves, and hand sanitizers. Buses were cleaned regularly and social distancing was enforced. That's also important in the microtransit because we can social distance very easily. We can find out how many people are on the bus at each time. Basically, what we've learned was our ridership is down 50 to 60%, which is huge. We had a shift in commuter services because people seem to work from home. the basic Massachusetts commuter transit shut down almost totally. So people weren't going to work. They were mandated to stay home. So now what we have to do is what we are doing is we're looking at low performing routes, especially for fixed routes. We're looking at maybe consolidating fixed routes. We're finding that microtransit service is the better alternative in our rural areas. It's easy to do with on demand, and social distancing is easy to maintain, and it's cost effective because we're not running a route 8 hours a day that's not picking up a lot of ridership. And it opens up the service area to people, especially in the rural areas. We've already established a microtransit service in South Plymouth that started up last week to help those people that we've suspended service down there. So we started a microtransit hoping that this is going to be a solution to their issues. We've eliminated 2 underperforming fixed route buses and incorporated the micro service for that as well. That's hopefully going to be done in December, and we're hoping that's going to be successful. So I think this COVID has been a wake-up call for transportation everywhere, that we kind of have to look at what's going to be the better option for each area, especially for future transportation. So thank you for having me, and I look forward to hearing to other people.
No, thanks, Joanna. And there's definitely some key touch points that we can deep dive into once we hit the topics, because the 3 main topics, the health and well-being, the service side, and also funding, because I found, so waiving the fares from March to August, that's something that we'd love to circle back on once we hit the funding side of things. And then also with the microtransit complementing the fixed route, that's also a very interesting topic, because that is something that we've spoken to customers about even prior to COVID, right? To optimize services as well. So very interesting touch points, and I'm also taking notes as we go along that we can deep dive into further down the slides.
Okay, thank you.
Okay. All right. And then you also mentioned that your new procedures and equipment with masks and requirements and social distancing, and happy to hear that the microtransit service is helping with the social distances as well. And it sounds like it's generating some confidence with your ridership base.
Yes, it is.
Okay. All right. Okay. Now let's move on to Bay Area Transit Authority. And over to you, Eric.
Thanks, Jermaine. I'm Eric Lingaur. I'm the Communications and Development Director for the Bay Area Transportation Authority. We are located in Traverse City, Michigan, which is up on the banks of Lake Michigan. And we only get confused with another Bay Area Transit about once a month when people contact us about their Golden Gate Bridge fares or a trolley ticket that they wanted refunded and things like that. But we serve a 2-county area in northern Michigan. Non-COVID times, we do just about 600,000 rides a year. We're also similar to what Joanne said. We're an urban and a rural mix in northern Michigan. We've got a fixed route system, traditional demand response dial-a-ride with a complimentary paratransit, and then just recently we added on demand, and we'll talk about what that means for us and why we decided to bring that service on during a pandemic in this particular case. So the next slide just kind of highlights a lot of things that Joanne already mentioned, but we experienced this in northern Michigan as well. The focus on essential transportation has been key in the shift in mobility in our region. We basically went to about 80% of what our service was, looking at ridership demand, and where the essential transportation routes were at with those folks getting to health and wellness appointments, getting to essential jobs at the local hospitals, getting access to the grocery stores and things like that they needed. That was the majority at the height of COVID. We're talking, March, April, May. Then starting in midsummer, we started to kind of bring stuff back slowly. Northern Michigan, the area that we serve, is a very also tourism-centric region. So we had to balance bringing service back with providing essential transportation, but also having a lot of influx of folks coming to Northern Michigan because they weren't allowed to travel anywhere else. Not a lot, they weren't flying, they weren't leaving the state. And so a lot of folks from Southern Michigan were coming up to Northern Michigan. And how do you handle that? Trying to, stay at half capacity with all the social distancing measures that we have in place. Of course, we had a regiment of cleaning and sanitation that was already in place, but just taking that to the nth level and adding the additional steps and the sanitation and cleaning methods to our entire fleet. We've got a fleet of about 80 plus vehicles. So, that's a time-consuming process and materials and things that we didn't have before that now we've made a part of that. And at first, access to those materials was hard. We couldn't get to it. So luckily, we have a really good community around here. And so like the local school system, they weren't having it real school, so they let us borrow their foggers for a while until we could get our own. And there was a lot of community sharing to be able to keep essential services running across our region. And then, of course, we've talked about these social distance measures, facial coverings. In the most part, Michigan in general, we've had good directives. Recently, there's been some change in policy that's been very fluctuating, and there has been some kickback into some of these social distancing measures. You've probably seen some of the headlines of our governor being targeted by a local militia and the FBI announcing that. So it hasn't been an easy bridge to cross, let's say, but a lot of our community here in Northern Michigan has been adherent and acceptant to those. And we could have a whole nother subject on customer interactions when it comes to social distancing mandates and things like that as well. But that's kind of the entire shift in mobility that we've seen in our region. The next slide talks about health and well-being. We'll skip that because that's one of the topics that we'll focus on, but health and well-being as far as both our ridership and our staff. We'll focus on that as a subject a little bit later. And then, so what does the future of mobility for us specifically look like? And I mentioned that we decided to launch an on-demand service in our area during a pandemic. And that sounds crazy, but it's been a really good move. We did have the plan to launch an on-demand service as we were getting into January, February. And of course, the pandemic impacted being able to launch that. We were going to launch it in May, but we decided to still stick with it. And it's been a really good source of providing an alternative transportation option for our region, especially with the ability to use TransLoc and the features and functionality. We've basically had excellent results to provide that, and just another layer of service that is more one-on-one and focused on where people need to go. We've had excellent results so far. We've been able to reduce our no-show rates from about 20% down to 3%, with people just requesting rides that they need. We've seen increased efficiency, being able to do more with less vehicles and drivers on the road, reducing wait times, and then data. It's been magical to be able to have this level of data. We're coming from like the Stone Age, where we've got an access database that's 2 weeks behind that we're manually manipulating, and to be able to have it at your fingertips and help you make real decisions when you need to be flexible in a time during a pandemic has just been fantastic. And then these are something that our community has been asking for, a service like this for a long time. Not only the technology elements of it, of being able to use a mobile app or a website or request stuff and on demand, but then just having this functionality that's like an Uber or a Lyft to be able to request rides when they're needed. And it's been a really benefit, especially during a pandemic, to be able to have something like this to supplement our service footprint.
So Eric, I guess it's a very bold decision to launch a brand new service in the middle of the pandemic. And so how did you find the the onboarding experience? Because I can imagine that you have a lot of priorities that you have to manage on a day-to-day basis. So how did you find that onboarding experience and the deployment of this service?
So I'm gonna talk just a couple different aspects. So one, so as we brought service all the way down to almost, just bare bones, it helped to be able to bring a new service online as we were bringing stuff back, because it would kind of just made sense of, all right, we're bringing stuff back and we're adding additional service to be able to supplement that. From an onboarding experience, we were really nervous about not only our staff, but also our community to being able to adapt to something like this. And a lot of preparation went into place. We gave our riders about a month and a half education and awareness regimen as we rolled out communications to folks. So we gave them a lot of time to get familiar with it. The same with our staff, with a lot of training and hands-on interaction to get them prepped. And we did have fears about bringing something like this on when there's so much volatility in in our area with the services and things like that, but it went very, very smoothly, and it's been adopted quite well.
Yeah, absolutely. And it sounds like a success story with some of the numbers that you're saying, 20% no-show down to 3%. And the data sounds very valuable to you as well. It seems like you have a massive improvement in your business intelligence data suites as well, and especially with the uncertainty with the pandemic from day-to-day basis. And one thing I found interesting is that your ridership, you said it was down 80%, and Joanne's ridership was down 60%. So I guess Joanne is a little bit ahead of the curve, because I think nationally it's at 75%. So you are at around average. So I guess kind of bringing in Joanne, I'm just trying to understand, based on your location, why do you think your ridership was down less than the national average? And I guess, Eric, to you, you're slightly above. Just trying to understand the differences in the location, what possibly is driving those things.
Well, I think our demographics our population's probably larger, a little bit larger. We're located in 28 cities and towns. So I think that's it. We service a lot of hospitals, so a lot of hospital workers had to go to work. And I think that, because Massachusetts was shut down for a long time, but it's slowly coming back, although COVID's kind of on the uptick, I think, in a lot of states. But I think that's one of the reasons. We have a lot of people that are really transit dependent. We have a lot of low income, basic workers that are going into the grocery stores. And I think those are the people that utilized our system.
Yes, and you've been able to also successfully pivot to ensure that essential workers get to where they need to get to as well. So that is a huge success story for you. So,
right.
All right, so well done. And Eric, I guess you're not as, I guess, condensed as up in Massachusetts there around the Boston area, I suppose. And you mentioned that your area was tourism centric, and I guess tourism has been down, globally. So that's probably not driving the foot traffic and the ridership traffic as you typically see, especially in the summer, right?
Mm-hmm. That's definitely been an impact. So one of the things that we've also seen is the seasonal workforce that comes into the area. Not only do we have tourism, but we have a lot of agriculture in our region, a lot of cherry farmers and things like that. And there just wasn't the seasonal workforce available to come into the region that relied on public transit when they come here during the summertime.
Okay, very good. No, thank you. Very good information there. Now, Richard, the man that shares my hairstyle. So, so you're up with Porterville Transit. There you go.
Yeah, thanks, Jermaine, and appreciate the comments by Joanne and Eric. And as we started on the East Coast, and now we're ending up on the West Coast. I'm Richard Tree. I'm the field service manager for the city of Porterville. Our public transportation is pretty simple, branded as Porterville Transit. And so where is Porterville? Well, if you were to come fly over to the West Coast and you go to Disneyland down in Los Angeles, it take you about 3 hours to drive north, and you'll reach Porterville. We're centrally located in the state, really the heart of the agricultural region for the state. If you're in the Bay Area, like Eric said, wanting to get your trolley ticket or going across the Golden Gate Bridge, you head south about 4 hours to get to Porterville. California really has been focusing a lot on clean air regulations. Our governor has been pretty aggressive in that. And so, for the last 2 or 3 years, we've been planning and trying to budget and implement those clean air regulations. And essentially, by 2035, we have to have a zero emission fleet. So it's quite a bit of planning efforts going on. But in Porterville, we have 9 fixed routes currently. We provide complimentary paratransit. Really have been, there's been a shift from providing overall coverage to our population, but now to a frequency-based approach. And there's traditionally in our community very limited mobility options other than the core fixed route and paratransit. Planning has been lacking in bike and ped. So they have been relying on public transportation to get around. Through our planning efforts, we really felt that there was going to be a shift in mobility from this coverage concept, providing options to everyone. We realized that, at some point it's just going to be too expensive to operate. And we knew that with a coverage focused base, our headways were extremely long. It really just wasn't convenient design of a system. So to get an understanding of what our community wanted, we really reached out to them and performed a community needs assessment. This started about a year ago, and it's changed definitely. COVID, how do you interact with your community? Are they responsive to Zoom? I think I'm just now getting comfortable being on Zoom meetings, but it is a way to connect with folks. But even a year ago was a challenge to understand and get the community aspect of what they want to see in the next 5 years. But it was really important for us to perform this community and needs assessment. And once we had a general idea of what the community wanted, we needed to look at our operation as well. And like Joanne said, we identified several low productive routes, and we felt that having an on-demand service or some other mobility options essentially gave us options to offer to our community. And we were really excited about providing options as a supplement, potentially for eliminating those fixed route or low productive fixed routes. So up in the right-hand corner, we did ended up quickly implementing microtransit. That's our vehicle. Interesting story. We weren't quite prepared to implement fixed route right away. We were actually waiting for zero emission vans to be produced, and that slowed our project down. But with the dramatic decrease in ridership in our fixed route and really the community wanting to ride on a smaller vehicle where they would likely have the chance of being alone or with very few people, they really said, now's the time to implement the microtransit. So we quickly procured some minivans, which are great. They can zoom around the community, but our end goal is to meet our clean air regulations. And so they serve as a quick solution to start the service. And then eventually we'll transition those vans over to electric. So the next slide is really to talk about the decline in ridership. We've all seen it. But what's interesting, so on the left is our fixed route where, the industry average or national average, about a 75% decrease in ridership. What's interesting is that, we thought, and our board thought, we would the state would be opened up and things would start to be going back to normal back in August. We never realized that this pattern is continued into October, and California is currently locked down. Our region is still closed, and it's making it very difficult on the economy. But almost the overnight impact on when we introduced our microtransit service, which is a ridership on the right-hand side, day after day, week after week, month after month, we just saw an increase in the usage of that. So we're really curious about why. Why is they're actually paying more to ride with the on-demand service, but what are the core reasons? And again, it came back to health and well-being of the rider. They just felt more comfortable riding in a smaller vehicle, which was surprising. Several of our board members thought they would be less likely to ride in close proximity to another passenger, since it's a shared service. They really gravitated to contactless fare payment, which operationally we were excited about. And then just the real-time communication of being able to book a ride anytime, seeing that it's when it's arriving, being able to communicate with the driver if need be, if they move to a different location. There's lots of positive things about it. And so moving on, the last slide is, well, what's our strategy for success moving on? We really think that it's going to be a mixture of the core fixed route, providing frequent service that the customers will feel like they can rely on, and that it's convenient for them. We think that there's enhanced mobility is going to play a huge role. It gives them options to meet their needs. We recently were awarded a HOPE grant through the FTA to start looking at mobility as a service. So we really think that there's a menu of mobility options that the community will gravitate through. Maybe it's bike sharing or scooter sharing, car sharing, van pool. We want to really study that and see, how, are we missing anything that the community wants? What can we implement? And what is maybe most cost-effective solution to provide mobility to our region. And then last is really embrace technology to improve the customer experience, lower operating costs, and really reduce health concerns. Our operators have been showing up to work every day, wearing a mask while driving a bus. They're the first interaction with customers. Porterville, interesting, has been collecting fares from day one. We've just made slight adjustments to our service hours, but over time, the operators say, I feel a little less comfortable dealing with cash. Our revenue counting folks said, maybe this isn't the best idea. So I think now trying to speed up a cashless fare environment is probably crept up to a top priority to help reduce those health concerns for our operators. So interesting times. We're excited to have options, though. Our board often talks about, just having options is important to them when it comes to funding or it comes to service. And we'll see if we can make the best use of it. So appreciate the opportunity to talk to you today and look forward to the Q&A.
Yes, Richard, and you're doing fantastic on Zoom, by the way. So it's no worries there. And what I love is the stakeholder culture that you created there in Porterville, where you did the community need assessment, and what it also resulted in was a win-win situation where you identified some inefficiencies, some cost inefficiencies, and now bringing in the microtransit service, which is more cost efficient for you and more service oriented as well. So that is a really good success story with the win-win. And the assumption of the reopen in August, I think many of us had those assumptions, right, including us on our side, and things changed, right? At first was a month, maybe 2 months, then August, and the uncertainty just lives there beneath the surface. So a lot of key touch points there. And absolutely, microtransit on demand can fundamentally complement fixed route. And then that is purely optimizing your service. And especially if you can have rich data to share between on demand and fixed route to truly optimize, which is something we promote from our side as well, and support it. That is just a great story there. So thanks for sharing that. All right, so just watching the clock here, so I want to make sure that we have time. And so Eric, health and well-being. Do you want me to go back to your health and well-being slides, Eric, while you talk through this?
You can, or it doesn't matter.
Okay.
Yeah, so really one of the things that we talked about as we were preparing for this presentation as a group is to share with you guys is the health and well-being of not only our staff, but our riders. I mean, this has become prevalent before COVID and during COVID. It just seems to rise to the top as even being more top of mind as a topic. And when we were talking about this, we were talking about it from all different aspects. And I'll just share some stories here from what we've done at BATA. One of the things, of course, is keeping transit top of mind with your passengers and with your community. When we've boiled back, and you take service down to bare bones, you want to let your community know that you're still there for them. And that's a big part for the folks that rely on transportation. It can be, they need to know that they can have that transportation at their fingertips, and that just keeping transit top of mind for the community, that we're there when you need it. We'll get you where you need to go. When they're ready to return to using public transit, to be there, especially when it comes to those choice riders, where the essential riders are already here, they're already using it, they know that we're up and operational, but it's getting to those other folks too that really helps the community as a whole to know that this service is available. And then from a staff perspective, it's really keeping morale up. It's physical and it's mental. Looking at those particular pieces, because you want to retain your staff. When we brought down our service level, and a number of our staff were either on a medical leave or their hours were cut back, it's really making sure that you have those touch points with staff, because in most cases, transit entities aren't used to working remotely. We don't do that we're here in the trenches providing essential services and things like that. So being able to virtually connect to staff that's used to coming in every single day is very, very important. And one of the things that our director did is we would set up just an open Zoom meeting. We'd set up a time where everyone, if you weren't on the road driving a bus, could just connect and see each other's faces, just remotely for a little while, and ask questions and ask how people's families are doing, and just sharing little nuggets that we're learning here about our business and next steps, and just kind of keeping those touch points so that we're all connected and that we're all able. And I think it helped as we started to bring back service and we started to bring people back on board, that we did have those touch points, and we continued them all the way through August to kind of keep those connections for folks. The other thing that we did, we have to change our mindset when it comes to the health and well-being of our staff, is we would do at the end of the year a big cookout. We'd set up shop, we'd have a giant grill, people would come and have hamburgers and hot dogs, and we'd all eat out of, everybody pass a dish and things like that. And that's not the case anymore. Right. It's at least not right now. We don't have the ability, but we still wanted to keep some normalcy, to still keep some of those connections with our staff. And so instead we brought food trucks in, and the food trucks could do individual orders. We could social distance ourselves. People could come and go, and all the cooking was done within a contained space. And it was just a way to say thank you to all of our staff, but also kind of keep that end of the summer celebration going, and keep those connections as well. So that's just kind of what I wanted to hit up on health and well-being. And Richard or Joanne can add any additional points as well, or Jermaine, if you have anything, but we're just kind of focusing on how essential those pieces are, as well as the transportation that we provide.
Yes, absolutely. I mean, mass transit to me is essential services, and the drivers out there every single day. I mean, there is a recent study by the former traffic commissioner of New York City, APTA, saying that mass transit is still a viable option. But as we know, on a day-to-day basis, there is still risk, right? And you know, the unfortunate events that you mentioned in Michigan with the governor, right? And if your drivers per se are trying to also enforce those rules of mask, you know, things can happen because you know, there is a lot of opinions about the COVID and how it should be managed. So yeah, definitely wanted to make sure that we spoke about you three as leaders as well, because you know, everyone needs support, and also your staff, as well as the ridership, both in safety and the morale, and keeping everybody as positive and as safe as possible. Yeah. Okay. All right. So just want to make sure we get through everything. So Joanne, so service, you know, you mentioned with the microtransit, and I know that we had some discussions before where you've supported some non-traditional services as well to support your community. So very also looking forward to this part of the conversation. So Joanne.
Yes, I think because our communities are so diverse and each one of our communities pay into their transportation funding, as well as federal and state, each town contributes something. So they basically sit down with us to let us know what they think they need or what they want. We do some surveys and things like that, but this has kind of opened our eyes to where we did suspend some services that do a cluster of 4 towns. And we kindly thought, we're going to restructure that in the future. They don't need that one fixed route bus that goes up and down one street for 8 hours a day, that we could open up those 4 towns to an on-demand service and expand the area and open it up to all residents as well. Basically, exactly what Eric said too. I think we have to make people feel safe coming back to public transportation. I think that's a big issue everywhere. People want to feel that they're safe and they're secure and able to take it. And I know the Uber and Lyft type of services, people are kind of nervous about the safety of the cleaning and things like this. Whereas if we have a microtransit that's run by a regional transit authority, all our drivers are tested under federal and state regulations, and the safety protocols are all in place with cleaning and things like that. So I think what we're doing is we're looking at each one of our towns to see how we can provide them different options that might be better for them as opposed to a regular fixed route bus, in addition to our dial-a-ride and things like that. But we might be able to consolidate our dial-a-ride into a microtransit or an on-demand for the day type of thing, calling for that hour or that day. And I've got a new administrator after 40 years. My administrator left, so I have a new person that started in February. The poor guy got baptism by fire when COVID set in 2 weeks later. But that's what we're doing. We're sitting down with each town to see how we can help them and what their options are and what they would like to have in each of their towns.
Yes, and the health and safety, again, with your organizations having to adhere to guidelines, right? Which is a key setting point, which should be publicized to, you know, encourage people to still use mass transit in a safe way and follow
yes, right. The public is really nervous about getting back onto fixed route buses, and we have to make sure that they know they're safe.
Yes, and again, I'm hearing the theme again as you know, driving efficiency, driving optimization, right? That single bus going down that fixed route bus going down that street. Now with on-demand, it opens up a lot more options for you and also your riders.
Exactly.
That's fantastic. All right, so segue into funding. So Richard. So you got your fare box and you got state, you got local. I guess that those are some key items that you all have to manage, and maybe there's some challenges there or maybe not. So let's hear what's in your neck of the woods with funding, Richard.
Yeah, I think, you know, funding is so important. It's such an important topic right now. Well, it always has been, but you know, I think what is interesting, we're thankful for the CARES Act funding. What a jolt in in our operation to be able to fund that so we can continue providing service during this pandemic and hopefully after. As it goes on, I think most agencies are concerned to see if there's a second round. You're starting to see large agencies starting to cut service because they're having to plan for the future. What I don't think is getting enough in the news is how much funding is being spent on sanitization of the vehicles just to provide that essential service. The number of or the funding that's being used to protect the operator. Joanne talked about the driver barriers. Those aren't cheap. The sanitation probably has doubled or tripled in each agency just to provide a clean, safe vehicle. So that all those costs are expensive. You have the loss in fare revenue, local sales tax. If you're relying on sales tax, there's a bit of an unknown there. So how do you plan for that? What are you doing to plan for the future to continue to provide public transportation area? I think it's interesting. I think it can be difficult. I think for us, what we've been doing is really as a region, we're opening up that communication. We're looking for ways that we can potentially reduce cost. We recently formed a joint powers authority with the 7 trans agencies in our area to consider combining administrative efforts to lower the cost of the operation, but to improve the customer experience in our area. We have to, with all that's going on, providing our regular service, the additional expenses in that, trying to take care of our operators by offering them hazard pay or other strategies to keep them employed and comfortable. We still, in California, we have this clean air regulation looming over us. In 10 years, we have to convert all of our vehicles to zero emission, where just 8 years ago, we had to convert our vehicles from gas and diesel to compressed natural gas. So it's just a cycle of managing it all. Makes it very difficult. Interested to hear what Eric or Joanne, your strategies as far as funding during this time and maybe here in the future, in the near future.
Well, I think the strategies are probably the same. Our budget's gone down, way down. We did get some CARES Act money. We are looking at hybrid buses. We are looking at smaller buses. And other than that, we're just hoping that we get some more funding, another round of the CARES Act, hopefully. But right now, we're just kind of going one day at a time, and hopefully we make it through. Because as you say, just the PPEs is so expensive when there's no one riding the buses for those 4 months or 5 months during the summer. Very, very few.
Yeah, definitely hearing a theme of uncertainty, which prohibits your ability to plan and forecast, right? Which all service operations leaders need to do, want to do, love to do, and so I can imagine. And I guess also minimizing costs is a way to also help with that, and it sounds like you're all successfully doing that as well. But ultimately, yes, hopefully your funding situation gets sorted as soon as possible so that you can get on with your planning. All right. So
Jermaine, this is Rich in Porterville. I find it interesting. Our fixed route, the ridership goes down. We're still collecting fares, but the revenue is down just as much. But with the success of the on-demand service, we're almost meeting that point where on-demand is generating more revenue than the fixed route service, which is really surprising. So now we're looking to we initially didn't want to provide monthly passes because we just didn't know enough to see if it was cost effective. But now that's generating much more revenue than we anticipated, and the board is more interested in promoting some additional fair media that might benefit our customers.
Yes, I would assume that would definitely capture their attention. So yes, very interesting case study. Yes, and that is fantastic that the on-demand service is generating even more revenue than the fixed route. So that is great to hear. So this is fantastic information, and just to make sure that we're in time as well, we'll segue into the Q&A and Casey.
Yes, absolutely. And Jermaine, if you want to just pull up that last slide for you guys with all the contact information for everyone. If we don't get through all of your questions today, please feel free to reach out to the panelists to make sure your question does get answered. Once again, if you do have a question, please type it in the Q&A box, and please also try to give me the person that you would like the question addressed to. This first question, Joanne, this is for you. I kind of saw it on one of the slides toward the end, and maybe just getting a little more clarity about what microtransit looks like for you all. Is it shuttle to vans, and what that might look like? If you could just kind of expand on that a little further.
Our microtransit system is located in 3 small towns, Mansfield, Foxborough, Plainville. Foxborough is the home of Gillette Stadium and has a huge medical center. So, and they did not have any service at all. They had a local dial ride. So what we did was we have 2 vehicles that are on demand, so they can call with an app or call with dispatch, all accessible, and they can go from the commuter rail. It started with the commuter rail in Mansfield, because the Mansfield commuter rail in New England picks up 2 capital cities. It picks up Providence, Rhode Island, as well as Boston. So we started it there basically for first and last mile to industrial parks located in that area of town, of those 3 towns. There's 3 industrial parks, but actually it's kind of morphed into something else. It's morphed into a daily people going to work. We did do the first and last mile, but also people going to that medical center at Patriot Place. And it's been extremely successful, very successful. And it does hit the casino, but I don't think a lot of people are going there now.
Probably not at the moment. All right.
And we just expanded the hours because we do have a partnership. We have a partnership with Gillette Stadium and a partnership with Plain Ridge Casino. So they contribute to the operating cost. And Plain Ridge just joined, and they wanted our service to go later at night. So with their funding, we're able to do that.
Excellent. Thank you for expanding on that. This next question, Richard, I know you addressed this and you did this pretty well, and maybe if there's anything you want to add or for the other panelists to kind of tag on to, but this question is asking, are any of the MOD programs having shared rides? If so, are people comfortable sharing a trip with someone else in a small vehicle? And again, Richard, I know you addressed that a little bit, but if anyone else might want to jump in and answer that, I appreciate it.
Well, I know right now with the shared rides on all of our vehicles, they're only allowing X amount of people, probably 3, depending upon if there's a wheelchair on there, because they've all measured out the 6 feet.
Okay. Eric, anything you would want to add to that?
Yeah, so along the same lines. So we haven't really had any. Not a lot of the rides are shared rides. A lot of them are kind of 1 or 2 folks. When the busy times happen and the number of vehicles that you have on the road, the shared rides do kick up a little bit higher. So you might have 3 people on a vehicle at a time. What we've done is we've set the ridership max capacity for each vehicle to be socially distanced. So the program won't allow any more than a certain number of people on the vehicle to keep the social distancing happening on each vehicle. So it'll never load it more than what is considered safe.
Excellent. Okay. Appreciate that. All right, this next one, bear with me, panelists, is a 3-part question. Eric, keeping up morale is critical for all of us. To all the panelists who mentioned the pivot to offering on-demand service, that's great. All panelists mentioned reduced fixed routes and pared down services, but by definition, you're only serving essential riders who are also still served by a route that you are able to maintain. These questions are addressed to all panelists, and so the first one I open up to all of you. What is the impact on choice rider participation before and now? I don't know if one of you want to go first there, Eric.
In relation to on-demand or just choice riders in general with COVID, do you think, Casey?
Uh, let's say in general to start.
So definitely COVID has had impact on choice riders. The sensitivity to the safety on the vehicle, the sanitization and cleaning practices, taking your own vehicle or finding a different means to get to and from work or however you were using it before, definitely has changed the mindset. With launching on demand during the pandemic, I don't know if we have a sense of choice riders versus essential and using the on-demand service. I would say that maybe some choice riders are using on-demand a little bit more because it is more of a one-on-one transportation option and the ease and functionality of it. But we're only 2 months in, so I don't know if I have a strong enough footprint of data for that yet.
I think I agree with Eric. I think, more people like the on-demand for the safety reasons. Our choice riders for fixed route basically are right now, what I'm seeing is the essential workers still, that the people that really need the public transportation bus. So I think that's probably the same for Richard too. I just think that right now, public transportation that are for people that have to use it. Schools aren't back. So, and those that are, I think the parents are driving them if they have to, if they live in Massachusetts, in Taunton, if you live within 2 miles, you have to walk or take the bus, but schools aren't in session. So they're doing mostly remote.
Yep, exactly. Richard, anything else to add?
I think with the choice rider, it's been interesting with being able to find an option that fits them well. I think there's then folks that choose public transportation for the environment, or be able to save money by utilizing it. As a small urban agency, I think the choice riders have gravitated to on-demand because it does provide them an option that potentially save them money over the long run. I think folks are being a bit more vocal as this goes on, and the uncertainty with the economy. They're looking for ways to be able to save an extra $5 or $10. And this having on demand as an option, I think they're really considering it. And I think we have to keep up with that. And probably to the next question is, what are we doing to support the economy? We really didn't, our board never discussed a low income subsidy or low income program, but that's really at the along with, new cashless fare environment, they want to be able to give back to the community. And so a low income or some type of fare subsidy program to support those is really on the top of their priority. That's what we're actively working on right now.
Okay.
And Richard, I assume that this would make access to those communities more affordable for you with the on-demand service, as opposed to trying to put a fixed route vehicle through that community. Is that fair to say?
Yeah, it is. I think so. I mean, we have been operating for like 6 months, microtransit, so we're still learning a lot. I would say that, I think I answered one of the chats, is for us, it's a bit of a dance. You need to be actively monitoring it. We really felt that performance-based service was critical to us, to our success. So being able to schedule a ride and be picked up in 15 minutes was, I think, our key metric on the performance of it. But that takes our supervisors and schedulers to actively monitor that, to add vehicles when they get a sense or predict that demand is coming. and then take vehicles away when it starts to slow down in the off-peak time. So we're learning more, but in the end, we are finding it being a more cost-effective solution, especially for the neighboring communities. I think we're going to quickly branch out to those as being able to provide a viable option to them here in the near future.
Excellent. Well, as we have already reached here the top of the hour, and I want to be mindful of everyone's time. Again, if you have a question for any of our panelists that did not get answered today, I know there were a few more, please feel free to reach out to them. I want to thank all of our panelists for a very well done job, and Jermaine for moderating this panel today. You guys did an excellent job of very pertinent information. We appreciate your time. And to TransLoc for sponsoring today's webinar, we appreciate all of your support. I want to thank you all for joining us today. Please feel free to start registering for our next webinar coming up on Thursday, October 29th, sponsored by Loom. It is entitled Reduce, Relocate, Revitalize, the Expedia Group Commute Story. So look for us on the website to register right now. And thank you all again. We appreciate your time and have a great rest of your day. Bye-bye.
Thank you. You too.
Bye-bye.
Bye.